Hello, dear students and esteemed learners. Welcome again. This is lecture number 33, and in this lecture, we'll talk about vaccination and universal immunization program. You all are familiar with the word vaccination and immunization, right? We all have been vaccinated at some or the other stage. Of course, during childhood, and then very recently during COVID also. So we know, we understand. And vaccines are actually very important. These have played very important role in developing the immunity against the certain disease causing infections. And that is why we got vaccinated during this COVID 19 pandemic also. And the theme of this week's lectures is healthcare structure and major health programs in India. So we are trying to understand the structure of the health system in Indian context, and the programs related to vaccination and immunization are very important for the healthcare system. And as we will see during the course of this lecture, that these are perhaps the most crucial things, the most important thing, played the most crucial role in decreasing mortalities and improving the life chances. And perhaps we are not even aware of how many vaccines we generally used to take. I don't know if anybody who is not a caregiver is aware of that in the family, the newborn baby or a child, how many vaccines he or she has received recently, right? Because this has become such a normal thing for us, it has become part of life. But how did we reach to this stage when these vaccines became such an integral part of our life? Was the condition like this 100 years before? And you will not get a very encouraging result. The situation was not like this. We have seen that the pandemics and epidemics were causing huge mortalities. In one of the lectures, we have taken an overview of the important pandemics and the number of deaths caused because of that, not only in one country but globally. So, these vaccines are the most important interventions developed by humans in the fight against those diseases and the communicable disease. So, in this lecture, I have covered very important things. Let me just give you an overview. So, vaccination we are going to talk about, then vaccination in India before independence, and vaccination in post independence India, and then we'll talk about the uh, beginning of the universal immunization program, and we will also talk about some of the new vaccines which have been added within the universal immunization program. That means this is again evolving, and very recently we have added few vaccines within the universal immunization program. That means this process of keeping people safe from undesirable conditions and making people follow some of the preventive mechanisms is actually integral part of our healthcare system. So it will also help us to understand the structure of the health system, because generally we think of only the hospitals and clinics as the healthcare system. But basically, this is more than that. And this is one of the important purposes for including this topic, because we are trying to understand, as a student of sociology, the the functioning of the healthcare system, the growth of the healthcare system, and how the healthcare system is making the kind of positive impact in human lives. All these things we are trying to understand, and so this topic is very important. So, what is basically vaccination, and how did we arrive to the stage of vaccination? So, before vaccination, basically, there was a practice of inoculation, right? And along with inoculation, some new techniques emerged where some kind of engagement with some of the viruses was also taking place. So, this virus plus inoculation, that is basically becoming variolation, right? So, I thought of adding this point because in some of the older literature, you will not find the word vaccination and you will find the word inoculation, right? So, as of today, vaccine has become so normal and so natural that we cannot think of anything which would have been happening prior to this stage of the advanced medical system or public health system. But yes, these terms are important. So, inoculation with smallpox virus material called variolation, and that preceded the smallpox vaccination and was one of the accepted approaches to protect from the disease. So, before the arrival of the vaccine to control the smallpox, there was a system of inoculation, and we have been saying that in every society, in every culture, there are certain practices which help the people living in that society to address the challenges coming from the disease and the pandemics or epidemics, depending upon which point of time you are talking about, right? So, these were some of the practices, inoculation and variolation, which were prevailing before the emergence of the modern vaccines. The first vaccine was discovered in 1798, and that was basically the vaccine of smallpox. The most striking success of these efforts has been the eradication of smallpox disease from the planet over a period of time. So, once the smallpox vaccine was discovered in 1798, then it took more than 250 years, basically around 250 years, to reach to that advanced stage of vaccine which could be instrumental in eradicating the problem known as smallpox. So you see the time period basically which it took. The first doses of a smallpox vaccine limb in India arrived in May 1802. That means just after the discovery in 1798, 4 years after that, it arrived in India. Of course, the British India, that time it was. The proven benefit of smallpox vaccination had such impact that variolation was outlawed in many European countries and also in some provinces of India as early as 1804. However, variolation continued to be practiced in India even after ban until early and mid 20th century, because uh, those were part of the cultural life of people. So, as the modern vaccines have not reached to those uh, societies, they were continuing with the older practices. The vaccination in the 19th century was implemented through vaccination and sanitary departments, and the sanitary commissioners were in charge of these efforts. So we learned that in the 1850s in the United Kingdom, the sanitary inspectors became very important, and their role was very important because that was instrumental in fighting against the epidemics. And so we were having those sanitary inspectors, and they were playing crucial role. So the focus was not on the medical care provider as such, because those were not available at that point of time. The focus was basically on the other administrators or officers or professionals who were taking care of the environmental health related aspect, the sanitation and other aspects. The Compulsory Vaccination Act was passed in India in 1892 to ensure higher coverage with smallpox and reduce the epidemic. So, at that point of time, a law was made, an act was passed, and which was basically intending to make vaccination compulsory. And that act became effective when there was actually prevalence of epidemic, right? So this is how epidemic was actually controlled in India. Till 1850 the vaccine was imported from Great Britain. So although in India there was use of the vaccine, but initially it was imported from Britain, and later on it was developed in India. So this also indicates that India has developed the advanced uh, technology of developing the vaccines, which were primarily developed in Great Britain at that point of time, and that is why India became a producer of manufacturer of world class vaccines that we saw during the COVID-19 period. Another important event of this period was a cholera epidemic in Bengal and other parts of India. So, cholera is one of the very serious challenges, and it was again an epidemic. We have seen the instances of cholera globally, and that was causing huge mortalities. Following a recommendation of the British government, the government of India accepted a request of Dr. Hafkin to come and conduct cholera vaccine trial in India. So cholera was a global problem, and there were some initiative taken in the United Kingdom, and so there were people, experts who have developed certain vaccines and wanted to have some kind of clinical trial. So Dr. Hafkin was allowed to come to India and make those trials. In 1893, Dr. Hafkin conducted vaccine trials in Agra, Uttar Pradesh, and showed the efficacy of this vaccine in the effective control of the disease. So, when a vaccine is developed, a trial needs to be ensured so that the efficacy could be known. Then again, a third epidemic and pandemic, that is plague. That was again a big problem, not only globally but also in India. And it started in India in 1896, which led to the enactment of Epidemic Act of 1896, which is still applicable in the country. So we were having multiple problems, and this problem of plague was again very serious, very complex. The government of India requested Dr. Hafkin to work on the development of plague vaccine, was already here, and Hafkin developed plague vaccine in 1897, and it is arguably the first vaccine developed in India. So the plague vaccine was developed by Dr. Hafkin, and it became the first vaccine developed in India, because prior to that we were using the vaccines which were not developed in India. Then there is another problem, and that is related to typhoid. We have seen this at the global level in some of the previous lectures also. And typhoid vaccine trials in India were conducted between 1904 and 1908. The Anti-Typhoid Committee of British Army Medical Department carried out extensive trial of typhoid vaccine in many units of British Army, joining their operations in India and Egypt. And the committee reported six-fold decrease in attack rate amongst vaccinated. That means it was considered to be beneficial for the people, right? So this way we can say that in early 20th century, at least four vaccines meant for smallpox, cholera, plague, and typhoid were available in the country. So this was a big story uh, in the pre-independence era that India already had four important vaccines which were useful, instrumental in controlling the epidemic and pandemic. Now, the rest part of the lecture is about the vaccination programs and policies in post independence India. So, at the time of independence, India was reporting maximum number of smallpox cases in the world. The cholera and plague epidemics were occurring, but focus on control of these diseases was restricted because the focus was more on smallpox. We talked about this in the previous lecture also. Then there was another problem, that is tuberculosis. Tuberculosis was perceived as a major cause of morbidity and mortality. In May 1948, the government of India issued a press note stating that tuberculosis was assuming epidemic proportions in the country and that it had, after careful consideration, decided to introduce BCG vaccines or BCG vaccination on a limited scale and under strict supervision as a measure to control the disease. So, BCG vaccination was the only thing that was available at that point of time for controlling tuberculosis, and that was very effective also at that point of time. And later on we got to know that that is really effective. So we all have heard about the BCG vaccines. In August 1948, the first BCG vaccinations were conducted in India. BCG vaccinations became part of the National Tuberculosis Control Program, which was started in 1962. So, this is basically the vaccine, and it became part of the disease control program also. So, we are talking about this from the vaccine perspective. The Pasteur Institute of India developed influenza vaccine in 1957. And so we can see that there are so many vaccines getting developed in India. Influenza, a very important respiratory problem, and that was also responsible for causation of so many mortalities globally. So we developed basically vaccine for that, and just like that for rabies, and then the oral polio vaccine also, right? So we had this phase which was dominated by development of certain vaccines and then their application and the efforts to make use of these in the controlling disease or the disease control programs. And here we see that there was an important intervention or development at the level of World Health Organization, because the World Health Organization launched expanded program on immunization, that is known as EPI, in 1974. And what was the triggering force? The triggering force was basically eradication of the smallpox in the developed part of the world. Basically, there was a claim that it is eradicated, although it was not eradicated completely because many of the developing countries were having the problem. But yes, from the developed part of the world, it was supposed to be eradicated, and that has given WHO a new kind of energy. And so it started the expanded program on immunization, because it was not established that immunization can help in preventing the occurrence of disease, because the world has already seen the experiences related to some of these vaccines. As soon as India was declared smallpox free in 1977, the country decided to launch national immunization program called expanded program of immunization in 1978. So WHO has suggested that, and India implemented that with the introduction of BCG, OPV, DPT, and typhoid, paratyphoid vaccines. That means now we are having a immunization program where we are having certain vaccines, and this could be used for preventing the occurrence from certain rather good number of diseases. So we reach to a advanced stage where we can control the occurrence of, or we can prevent the occurrence of the disease itself. The target in the EPI was at least 80% coverage in infancy. The vaccination was offered through major hospitals and largely restricted to urban areas, and thus, understandably, the coverage remained low. However, this is important to know that most of these vaccination programs or immunization programs were either confined to the big metropolitan cities or the urban areas. The rural part of the country was not getting the kind of benefit of these initiatives the way they should have got. The EPI was re-christened with some major changes in focus by the launch of Universal Immunization Program on November 19, 1985. And here I have one important acknowledgement, because good number of information that I have presented so far I have taken from a research paper that is available in the open access mode, and it is written by Chandrakant Laharia, right? And that is published in Indian Journal of Medical Research. So I have acknowledged that, I have cited the work also, right? And this is available in the open access. So if you want to understand the important developments related to this other than these things, you can go through and read the things at length. Then we need to talk about the universal immunization program, but we have already understood basically how these vaccines are becoming part of the immunization program. So we will talk about few things only certain numbers, certain facts, and certain years. So in 1985, the universal immunization program got started, and then there are certain things which are related with this, but we have already understood how this program came into existence, so I will not talk about those small details. And then in 1986, basically a technology mission on immunization was launched, and that was intended to give a boost to the immunization program. And there were three important things like monitoring under Prime Minister's office, a 20-point program, and then coverage in infants were also monitored. Then in 1992, basically we had child survival and safe motherhood program. And then in 1997, reproductive child health program. And finally, in 2005, we had the National Rural Health Mission. And so in 2005, National Rural Health Mission program was started. This is a very big program. You might have noticed that most of the vaccination programs or the disease control programs were becoming effective in the urban areas, but the rural areas were not having the presence of this program. The people were not getting the kind of health benefit because the health centers were not developed appropriately in the rural part of the nation. So this national rural health mission became a very meaningful, timely intervention. We will talk about the primary health center, sub center, etc. And this NRHM basically gave a boost to those health centers. So it NRHM has made a meaningful contribution in developing the healthcare system also. But we'll talk these things when we will discuss this particular topic. As of now, we can talk about the measles and rubella, then pneumococcal conjugate vaccine, and adult Japanese encephalitis, etc. These were all became part of the universal immunization program in 2017, and then in 2019, tetanus and adult diphtheria also became part of that. So these were some of the important uh, things which became functional under the universal immunization program. Then, as of now, we can say that the UIP is including vaccines for 11 types of disease, and some new vaccines have also been included within the universal immunization program. I have mentioned the names. You can have a look on these names. So we cannot talk about these things because we are not left with enough time, but these are self-explanatory. So here is the think about this and activity question. You can have a look on these things. And so with this, we come to an end of our today's lecture. So thank you very much and take care. We will meet in the next class.